As you move to an outcomes-based reimbursement, you're going to move to a situation where lab needs to be part of a team that's helping in population healthcare management. And there are a couple of areas specifically where we've been working with health systems to try and do that. And that'll be to, when you look at patient order sets and testing algorithms, that's one of the ways that I think if you can use lab data more efficiently, again, looking to really maximize the efficiency of the lab system and the overall healthcare system for downstream healthcare costs. I'll give you a very real example of that. Clinical Labs of Hawaii, our lab in Hawaii, we actually work with some of the larger health systems, actually the largest health system in the state, and we manage about 42% of the hospital bed, the lab for 42% of the hospital beds in the state. And we work with Hawaii Pacific Healthcare to actually help them on their ordering within the hospital laboratory. And one of the most recent examples that we've been able to actually quantify some of the results on that, it was a C. difficile toxin assays. A lot of physicians were coming in, they were ordering this just immediately upon entry. We actually had our PhDs and our pathologists work with the health system and the physicians to develop an actual ordering set that's a little bit standardized. And through that ordering, we actually we changed the ordering patterns with the physicians, and we were able to develop a reflex test off an initial test. And based on the result of the initial test, we reflexed to the C. diff tox assay. And through that, we followed this through the system. And one of the things that we found out was that by ordering it, we actually did increase lab testing costs by about $80,000 a year. But by ordering the right test at the right time, we ended up reducing antibiotic costs by over $240,000 a year. Wow. That's just the tip of the iceberg on it. The result of this also reduced length of stay, which is a big thing for health systems these days, by 7 days. And actually reduced, we haven't totally finished quantifying the value, but we know it also reduced readmissions in the hospital. Very key things for the health system. And that's the example to me, and there are many more examples of this where you can utilize the lab to help reduce the overall healthcare costs.